Obamacare. But you've also said that you support elements of the law, such as requiring insurers to cover pre-existing conditions and allowing young adults to remain on their parents' health insurance plans to the age of 26. So my question is, if Obamacare is repealed, do you have a plan to ensure that the parts of the bill that you like remain in place?
Thank you very much for the question. I don't believe you can keep pieces of the Affordable Care Act and still make it function. One piece is based on the other. So I do support the full repeal of the Affordable Care Act. What I have said is that I believe that we have the best health care in the world. Unfortunately, it's also the most expensive. And what we need to do is we need to lower costs. The Affordable Care Act has done nothing to lower costs. Anyone in here who's had to pay a deductible or a premium has seen their insurance go up. And as a matter of fact, it's job killing. We've talked about the issues of that with 2.3% medical device tax. I say we can do a couple things. Let's try to lower costs of our health care. Let's do this by introducing market-driven reforms. Let's allow people to buy insurance across state lines. That'll force insurance companies to compete for our business by lowering their premiums and still maintaining the quality of care. Let's have substantive tort reform, $54 billion over 10 years, but the real savings will come when doctors don't have to practice defensive medicine. And with regard to people with pre-existing conditions, I think we can fix that. I think we should allow people, pre-existing conditions, people with small companies, people who are also just individuals, to pool together so they can approach the insurance companies and have the buying power that a large company will have. As a matter of fact, if we can take it a step further and put these small pools under the HIPAA regulations in 1996, which prohibits anyone from denying someone insurance if they have a pre-existing condition. So these are some of the things that I think we can do.
Congresswoman Tsongas?
Well, I don't believe the Accountable Care Act is a job-killing piece of legislation. All you have to do is look at the Massachusetts model. We created the template. It's a template that's been adopted at the federal level, and we have one of the lowest unemployment rates in the country. So obviously, bringing in the Massachusetts health reform was not a job-killing piece of legislation, nor do I believe it will be at the federal level. If you pool together everybody who has a pre-existing conditions, can you imagine the cost of insurance? It's the reason that you have a situation in which you try to bring everybody in, those who are healthy as well as those who've already been diagnosed with very serious or whatever illness, ones that we know will be more costly, is to bring the cost down. If you pool everybody from the that has a pre-existing condition, it will be exorbitant, and no matter how many people you put in it. And to address the issue of across state lines, this is selling insurance. Insurance is regulated at the state level. The Accountable Care Act actually provides an opportunity for states to come together and figure out ways in which they at the state level can figure out how to sell insurance across state lines. It's an effort not to take away that fundamental right of insurance companies of a state to regulate insurance companies. But what we're really talking about is repealing all the extraordinary advantages that have been done. It protects Medicare and adds 8 years of life. It creates access for millions of Americans.
Thank you. When I was talking about pooling, I was talking about people with pre-existing conditions, but also people who have small businesses with employees who don't have pre-existing conditions. So letting all these people pool together to diversify their risk. The Affordable Care Act, while Representative Tsongas says it was modeled after the health care reform here in Massachusetts, make no mistake about it, this plan was a plan that was a state solution for a state problem that wasn't meant to be applied across the country. And it has done one thing: it has not lowered costs at all, and it won't lower costs. And until we lower costs, we're going to have an intractable problem in health care. I will say this, Representative Tsongas, it's not going to protect Medicare. Did you say Medicare? I'm sorry, Representative.
I did.
It's not going to protect Medicare, which in your vote for this bill, you voted to take $716 billion out of a program that seniors have paid into to fund a program that they aren't going to have a part of. Now, you could say that's going to get rid of fraud, but it's also going to cut down on reimbursements to doctors, reimbursements to nursing homes, reimbursements to hospitals. I mean, you tried to scare seniors in the last election that I was going to take this away from them. You have materially changed Medicare by pulling $750 billion out of Medicare. And the medical reimbursements is a serious issue for people because doctors, hospitals, and nursing homes simply won't see them.
Can I address that issue?
We'll do this one more time.
The assertion that that the $700 billion weakens Medicare has been proven by multiple Pulitzer Prize-winning newspapers to be not true. The reality is the $700 billion is diverted to add benefits in Medicare. Medicare is a guaranteed set of benefits for every enrollee. And this adds benefits, it eliminates a copay for preventative health measures, it closes the donut hole, and it adds 8 years of life to Medicare. It strengthens Medicare and adds benefits for every enrollee. Multiple newspapers have said that any other suggestion is not the case.
Mr. Golnik, that was 60 seconds.
Representative Tsongas, it cuts reimbursements to doctors, hospitals, and nursing homes, and that's going to allow doctors, hospitals, and nursing homes who are already not accepting Medicare patients to not accept more. At the end of the day, what we need to do is we need to bring healthcare costs under control by market-driven reforms, and once we do that, we can really get down to the business of solving the problem that we have with Medicare.